Hospitals across northern China are filled with families seeking care for their sick children. Some are waiting hours for treatment. Respiratory viruses such as influenza and mycoplasma pneumonia, a type of bacterial infection, have been spreading for weeks. This is China's first winter in 3 years without strict COVID-19 rules. Doctors say the end of pandemic restrictions are largely to blame.
During the COVID time, everybody was just sheltered, everybody was sterile, in a way, sterile. So these kids haven't had any infections in the past. So now that they are now mingling in schools and crowded settings, it's as if they're getting the infections as the first time. So now they are just trying to build the immune system or antibodies again.
The World Health Organization has asked China to provide more information about the uptick in respiratory illnesses. Beijing says the clusters are caused by known pathogens, but the surge has reminded many of the initial spread of the coronavirus. China was criticized for a lack of transparency at the beginning of the pandemic in 2020. It's an association Chinese officials are determined to dismiss.
Recently, we have seen some clusters of flu cases among children in China. In fact, this is very common in many countries, and in China, it is under effective control.
Authorities have urged community-level healthcare services and clinics to work harder.
This is Beijing Children's Hospital, a top paediatric facility in the city. Recently, they've been receiving more than 9,000 patients every day and have been forced to expand their capacity and number of beds.
This private hospital has temporarily lowered its fees to ease the demand on public facilities, but the advice across the board is the same.
Right now that we're seeing surge, it's better to put on the mask again and then practice hand washing.
Though the lockdowns of the COVID-19 pandemic are over, doctors here say many of the habits learned during that period should be observed again. Katrina, Al Jazeera, Beijing.